Hi, I'm back from the surgeon from my 5.5 week checkup. It's been a very big day for me. I left home at about 10 a.m. It's now almost 5:30. My sister came and picked me up because I can drive short distances, but I'm having to hold the seatbelt away from my breast when I drive, otherwise the seatbelt against that hurts, and I can't drive too far, like one-handed holding the seatbelt away, and it's just, driving for me is still exhausting even this far out from surgery. And my plastic surgeon is about a 45-minute drive from me, so she came and got me, and then, by the time we drove around and, we went to the shops and dropping other kids off and picking stuff up and visiting my grandparents and everything. So it's been a very, very long day. I'm absolutely exhausted. Went really, really well. Plastic surgeons, he took out those few stitches, the two that were in my nipple and the one just underneath here. Did not feel a thing. The nurse took all the other stitches out. They weren't too bad, but some of them hurt a little bit. These ones I didn't even feel, and I even watched him taking the stitches out of my nipple, which was very, very brave for me. Didn't hurt at all. He had a look at everything. He said everything is healing completely fine. I showed him that new little hole I've got down here, and he said that's fine. He said I'll probably even open up a little bit in a few more places before I completely heal up. That was a joy to hear. But, he's told me that it's completely normal, so I'm not too fussed about that. If it happens and everything looks fine, it'll be okay. He said all my other little bits and pieces that were still open, a tiny little bit in that little hole that I've got under my nipple, they're all fine. Best news ever, I don't have to tape anymore. That was such a relief to hear that, because I hated taping. I hated taking it off. I hated putting it on. I hated going to the GP's clinic to see the nurses to have it taken on and off and all that crap, and the tape is really uncomfortable to wear as well. So I am completely tape free, I am stitch free. He said also the little bits that are still open and that little hole beneath my nipple, I don't even need to cover them. He said I can just leave them to the fresh air and they'll be fine. I can shower. He said I can have a bath if I want to, but no swimming in a public pool for a while, which I would not do for at least a couple more months until absolutely everything is watertight, completely 1,000,000%. I get sick swimming in a public pool without having open incisions sometimes. He also said that I don't need to wear a bra 24/7 anymore, but I should still wear a crop top to bed, which I think I would do anyway, just for that, just that little bit of added protection, that little bit of security, I should say security. Oh, I asked him about this underneath this breast where it was still quite red and it almost looked kind of bruised. He said that's normal. He said it's probably actually going to look worse yet before it starts to look better, and that's completely fine. But he said it's dented in there because he's had to stitch my inframammary fold up higher to lift it. He's lifted it about 5 centimetres from what I can tell, because I'd lost so much weight and I'd become so saggy that everything sagged down. So that's about 5 centimetres higher. And the way he did that when he cut underneath my breast, and then he's hitched that up, and he had to secure it somewhere. So that is secured to my intercostal muscles in my ribs with these stitches right across. And that's like an anchoring stitch, I think, where he's anchored that fold to my ribs, or the muscles on my ribs. So he said that it's normal for that to still be sore, it's normal for it to be indented, but over time that will get better. I asked him as well, because I've been getting soreness in the sides of my boobs, and when I do things like taking lids off and opening my car window, it hurts and my boobs are jumping in the sides, I've got muscles there. And so I thought, when he'd taken the tissue from under my arms and flipped it over into my breast, that he maybe took muscle as well, which I thought would have been a little bit odd, but he didn't. He only took the subcutaneous tissue, and it's just everything working how it's meant to work now, essentially. I also asked him how much tissue he did take from there to put into there. When he did the reduction and lift, because I really had nothing. If you don't believe me, go back and have a look at my pre-op video where I get my saggy baggy long boobs out. It was really only skin with very little breast tissue left. So what he's taken from my breasts in the reduction and the lift was about 300 grams per breast. and what he's taken from the side here and flipped around into my breast was about 300 grams. So I've essentially got the same volume in my boobs, but it's just all beautiful pointing out breast rather than hanging down all skin breast. Now also when he's done that, I think it's called a spiral augmentation or autologous augmentation, something like that. So I've essentially had a reduction, a lift, and an autologous augmentation, which just means I've had an augmentation but without an implant. The augmentation has come from my own tissue. Yeah, so the tissue that he's taken around there and he's like spiraled around my breast to give that projection and the fullness. I don't know if you remember, I've got some swelling here. I've got swelling and rock hardness on the left breast as well, but it's more pronounced on the left side. It's not a hematoma, it's fat necrosis, so it's just the fat there. The fat has died. That will take care of itself. It will break down and my body will reabsorb it, and it'll be fine. I'll have a nice soft breast there and it'll drop down. It won't be swollen and everything, but that's going to take some time. So he showed me how to massage that, and I've got to actually massage it really quite hard, and I'll make another video of that when I've had a couple of practice goes at massaging that to show you how I've been shown to massage the fat necrosis. And also he's shown me how to massage my scars, because you know underneath the incisions dig in a little bit because they're quite tight. So, but I'll be massaging all of the scars. It's just good to help with healing, and you get a better result. And you can get really fancy, really expensive silicone gels and silicone tapes and all this sort of stuff to use. It costs $70 or even more. I have found a 100% silicone gel in the supermarket in the condom aisle. It's a personal lubricant. So I'm going to be using that, and I told him that, and he said that's fine. He said he doesn't care what I use it. I can use olive oil, I can use Vaseline, whatever I want. It's not about what you put on the scars, it's about the massage. So I will be doing that, and I'll show you how I do that when I've had a bit of a practice run at it. And I've got to massage quite firm, and he showed me how hard he wants me to massage, and it didn't hurt. So I'm glad he showed me, because I would never have had the balls to massage my breast that hard. And he said, I don't need to, and I said, so do I just not massage the bits that are still open? He said, no, I could still do that, and I can still put the silicone on that, that'll be fine. So everything's seeming really, really great and healing. He's very, very happy with me. He wants to see me again in 2 months' time. So I've got a little bit of a break there of, so I can get a bit of massage going and all the rest of it. So I'm very, very happy. And initially, he said that I couldn't go back to the gym for 8 weeks, which was, it's only been 5.5 weeks, and I'm going crazy. All my fitness is gone. I'm getting puffed out walking up slight hills. My strength is gone. I laid down on the floor last night to lay down flat on my back because my back is absolutely killing me. And I also asked him about that because he asked me if my back pain was gone, and I said it was gone for about 10 days and then it came back with a vengeance, worse, spread out more. And he said that's just everything realigning, and I'll have to work on my posture and just, get everything aligned where it's meant to be. So, I'll see a physio and I'll go back to the gym and hopefully that will get better. But so I got down on the floor last night to lay down, just to lay flat on my back because it helps my back. And just that action of just getting down on the floor and laying down and getting back up again, I was exhausted. That just about killed me. And you're looking at, I normally go to the gym like 3 times a week, and I'm up and down off the floor and planking and doing bridges, and I can do a bridge and I can hold a bridge up for like 2 minutes. I can barely get my hips up off the ground anymore. It's absolutely crazy. I haven't even tried a plank. So I asked him very nicely if I could possibly go back to the gym a little bit earlier, and he said that I'm healing so well that yes, I can go back to the gym, but to take it easy. So I might hit the gym tomorrow. I'll have to go because my membership's been suspended, so I'll go and if I can sort all that out, I'll go tomorrow, or maybe Saturday or something, I don't know. So I'm very, very, very happy about that, but it will be a very modified, I'm not going to go and do an hour of a hills program on the bike and then go and do half an hour of like heavy weights and, full on planking and lunging and squatting and all the rest of it. I'll probably be there for a maximum of about 30 minutes. I will do 10 minutes easy walk on the treadie just to warm up because it's not going to take much to get my heart rate up these days, I'll tell you that now. and then just some very, very gentle weights. I asked him if I could still use the lap machine, because that's and you can see I have trouble reaching up, but it's an overhead machine. And he said yes. He said I'll probably feel some pulling through here when I do that, but to ignore that pulling, because that's fine. It's normal. I'm not going to do any damage. So that's good, because the lap machine will really help to strengthen my back as well. So it'll just be a very, very easy workout, much lower weights. I will not be going near the captain's chair for a very long time, and I'll go very, very easy with things like planking and push-ups and that sort of thing until I know that I actually can do it. Obviously I won't be able to do anything where I lay flat on my tummy, but I don't think I'd do anything where I lay flat on my tummy anyway. So I think that's all. I was very happy with today. He was very happy. I did ask him when I get my tummy tuck next year, because he's going to have to do it in a 2-stage procedure, because I've got a very big previous abdominal scar. So I think it's called a delayed procedure, I think, where I go in and he cuts like around the bottom of my tummy where the scar will end up being, cuts me and then just stitches me back up and sends me home for a couple of weeks. And that's to shock my body into making the blood vessels go down to where they need to, I think, because all the blood supply will be disrupted underneath my previous big scar. And it's like a scar about that big. It's a really big scar. And of course, if there's no blood supply there, then you run into like skin necrosis issues, which we want to avoid. So having that cut made and then left for a couple of weeks shocks the body into improving the blood supply. That's the theory behind that. So my tummy tuck will be 2 surgeries. And given how much pain I've been in with this breast reduction, and I know that the tummy tuck will be worse, was particularly with the muscle repair, and I'm having a fleur-de-lis procedure done, I asked him, there's a pain relief thing, like a local anaesthetic, where they put a tube, much like a drainage tube, inside your stomach, along where they have the muscle repair done. And it's like, like those sprinklers that have got like a hose with the holes in them? It's like that, but it shoots out local anaesthetic. So I asked him if I could possibly have one of those inserted, because I know they don't do it as a matter of course with these surgeries, but given that I do have a lot of problems with pain, I asked him if that would be possible, and he said yes, they can order one of those in for me. So that is a very, very, very big relief. And I know they only leave it in for a few days, but if it can make those first few days easier, that'll be a big big weight off my mind and off my tummy. See what I did there? Anyway, I think that was it. So that's it for now. And as I said, when I become really good at massaging my boobies and my scars, I'll show you how I do that, and I'll show you the silicone gel that I buy and where I buy it and how much it costs and all that sort of thing. And then I can take some before and after shots of my scars so you can see if it actually does any good. But other than that, that's it for now. If anything more major happens, I'll make another video for that. But for now, that's it.